It's an excellent question. And young adults with IBD are already known to be at higher risk for active disease, poor adherence, and increased emergency department use and hospitalization, especially during that transition from pediatric to adult care. And looking specifically at this age group showed that on the top of these medical risks, they face a disproportionate insurance barriers and financial strain compared to pediatric patients who are under their parent care or older adults. Young adulthood is also when many patients first manage their own insurance and move off their parents' plan, making them really uniquely vulnerable to step therapy, denials, cost sharing that they're really not prepared to navigate. One of the most striking findings was that 35% of young adults reported step therapy mandates in the prior 12 months, and those were higher than the adults, with 35% of young adults reporting step therapy mandates compared to 27% of adults, and then 20% of pediatric caregivers. And what's equally concerning about the higher rates of step therapy in this young adults audience is one third of the young adults also reported low confidence in knowing when to ask questions of their insurer. Nearly 18% reported taking on extra jobs and working more hours to afford their IBD care. And these rates are higher than other age groups like the older adults and caregiver audience. Yeah, one key message for healthcare providers is to frame insurance navigation as a fundamental part of transition competency. And this is really on par with medication self management and building their medications into their adult routines. Clearly identifying a team member, such as a nurse, a navigator, a social worker, that can be the point person for insurance related issues and coordinating that handoff from pediatric care, where so much of this is handled for the young person by their parents and the healthcare system to adult care, can making that transition successfully can substantially reduce anxiety and prevent the lapses in treatment that young adults are experiencing. Clinicians can also direct their young adults to the Crohn's and Colitis Foundation's IBD Help Center, where we can help provide personal guidance on coverage questions and access barriers to help this young audience adapt to this new world of insurance that they're navigating. Yeah, so clinicians, the priority should be making their young people understand that they're here to get the right support and help them understand the practical steps and who to go to in their office to handle insurance questions, and access issues, and thinking about some of the other things that young people might not have the skills yet, such as including questions about financial understanding and assessing their health literacy. During these visits, whoever on the healthcare provider team is working with that young person, they can flag that they're at a potential for an insurance barrier and direct them to additional resources within the practice or seek external help like the Crohn's and Colitis Foundation's website, where we have a whole section for young adults navigating insurance. Or if the person really needs that one on one assistance to help explain things, maybe they're not the most health literate, the IBD Help Center is here to provide that deeper assistance to that young person. And lastly, clinicians and and healthcare teams, whether they be social workers or even office staff, should know that the foundation provides professionally created, evidence based, insurance appeal letters that are customizable to patient situations. And you can find those on the Crohn's and Colitis Foundation website under our science and professional section. And those appeal letters are down to be there to be downloaded and used by anyone in the office to help assist that young person along. I really appreciate this question because it really is about all of us working together. And clinicians can contribute practice based data on delays, denials, the outcomes that they're seeing that are negatively impacting young people, and use this evidence to really inform research questions that then can help set policy priorities that are focused on young adults with IBD. Researchers can then further dissect this information and work with insurance practices and to address this and also addressing those transition gaps so that we begin to create more of a smooth process for young people transitioning care. And advocacy organizations like the Crohn's and Colitis Foundation and many others can use the data that clinicians and researchers are using to advocate for policy reforms, such as really activating around utilization management, such as step therapy, improving transparency with between insurers and young people so that there's more information and better communication. And we can also advocate for better coordination of care for young adult IBD patients so they get the support they need so that they're not facing these denials. And jointly working together, the clinicians, the researchers, the insurance and advocacy organizations, we can develop better patient education, clinical workflows, and insurance facing materials that will really help leverage these findings into concrete improvements to improve access rather than what we have now, which are really more descriptive observation. We need to take this to policy, education, and other changes. I really appreciate you taking the time to elevate the conversation. And the Crohn's and Colitis Foundation is here to support our clinicians and our young people in navigating the difficult world of insurance.